One of the biggest mistakes nurses and phlebotomists make during blood draws is underestimating how much trust a patient places in their hands the moment that needle appears. Many healthcare professionals focus only on completing the procedure quickly, but they forget that every blood draw is more than a technical task. It is a moment where fear, anxiety, pain, and trust all meet at the bedside. Patients may never fully understand the medical terminology we use, but they always remember how we made them feel. They remember whether we listened, whether we explained the process, whether we treated them with patience, and whether we carried ourselves with confidence and professionalism. A simple mistake, like failing to identify the patient correctly, not verifying labels before collection, or rushing through preparation, can create serious consequences. One mislabeled specimen can lead to incorrect laboratory results, delayed treatments, unnecessary medications, or even dangerous clinical decisions. What may seem like a small shortcut in a busy shift can become a life-altering error for a patient, depending on accurate healthcare. That is why excellence in blood collection is not optional. It is a responsibility that demands discipline every single time. Another common mistake is poor communication. Some healthcare workers enter the room silently, prepare supplies without explanation, and begin the procedure before the patient even understands what is happening. This instantly increases fear and tension. Patients become anxious, muscles tighten, veins become harder to access, and the entire process becomes more difficult. But when you slow down, introduce yourself, explain the procedure calmly, and reassure the patient, everything changes. Confidence is contagious. A calm nurse creates a calmer patient. We also have to recognize the hidden damage caused by repeated failed attempts. Missing veins multiple times without reassessing technique or asking for assistance can destroy patient confidence and increase physical pain. There is strength in knowing when to pause, when to seek help, and when to prioritize patient safety over personal pride. Great healthcare professionals are not the ones who never struggle. They are the ones who remain humble enough to protect the patient first. Sometimes mistakes happen because people become too comfortable with routine. Reusing poor habits, skipping infection control steps, failing to let alcohol dry completely before puncture, or ignoring proper tube order may seem minor after doing hundreds of blood draws. But shortcuts slowly weaken professional standards. Excellence is built in the small details nobody sees. The strongest nurses and phlebotomists maintain high standards even during exhausting shifts because they understand that consistency protects lives. Every successful blood draw reflects preparation, focus, communication, technical skill, and compassion working together. Patients are not just veins, charts, or room numbers. They are human beings placing their trust in our hands during vulnerable moments. The healthcare professionals who truly stand out are the ones who combine clinical precision with genuine care. That combination creates confidence, safety, and respect that patients never forget. Small mistakes may seem invisible in the moment, but excellence is always revealed in the outcomes. Preparation, communication, and confidence are the foundation of every successful blood draw. Yet these are often the very areas healthcare professionals overlook when the pressure of a busy shift begins to build. Many nurses and phlebotomists believe the procedure starts when the needle touches the skin, but in reality, the blood draw begins long before that moment. It begins with preparation. It begins with mindset. It begins with the ability to walk into a patient's room fully organized, mentally focused, and ready to provide safe, compassionate care. One of the most common mistakes is approaching venipuncture with urgency instead of intention. When supplies are incomplete, labels are missing, tubes are disorganized, or patient information has not been verified, stress immediately increases for both the healthcare worker and the patient. Lack of preparation creates hesitation, and hesitation creates errors. A confident blood draw is rarely rushed. The best professionals prepare everything before they even apply the tourniquet. They know where every item is located. They double-check patient identification carefully, and they mentally review the procedure before beginning. That level of preparation does not waste time. It saves time, prevents complications, and builds trust instantly. Communication is equally powerful. Patients often arrive carrying fear that nobody can see. Some have had painful experiences in the past. Some are terrified of needles. Others are already emotionally overwhelmed by illness, hospitalization, or uncertainty. The moment healthcare professionals ignore communication, the procedure becomes colder and more stressful. But when we take even a few extra seconds to explain what we are doing, reassure the patient, and speak calmly, the entire environment changes. Something as simple as saying, "You may feel a quick pinch, but I'll guide you through it," can reduce anxiety dramatically. Patients do not expect perfection from us every second. They expect honesty, professionalism, and reassurance. When communication disappears, fear takes over. And fear affects the body physically. Tense muscles make veins more difficult to access. An anxious patient may pull away suddenly or become uncooperative. What could have been a smooth procedure becomes complicated because the emotional side of patient care was ignored. Confidence also plays a major role in successful venipuncture. Patients notice uncertainty immediately. If a nurse appears nervous, disorganized, or hesitant, the patient's anxiety increases within seconds. Confidence is not arrogance, and it is not pretending to know everything. True confidence comes from preparation, practice, and calm decision-making under pressure. It comes from respecting the procedure enough to stay fully present during every step. There are moments in healthcare when things do not go perfectly. Veins may be difficult to locate. Patients may move unexpectedly. Certain situations may challenge even experienced professionals. But confidence allows healthcare workers to respond calmly instead of emotionally. A confident nurse reassesses the situation carefully, adjusts technique when necessary, and never allows frustration to control the interaction. Patients remember that calm energy long after the procedure ends. Preparation creates control. Communication creates trust. Confidence creates reassurance. When these three qualities work together, blood collection becomes more than a clinical task. It becomes an example of professional excellence and compassionate care working side by side. The smallest moments of preparation and communication often leave the greatest impact on patient lives. Many blood draw mistakes happen not because healthcare professionals lack intelligence or training, but because they underestimate the importance of proper needle handling and specimen collection techniques. In healthcare, small technical errors can create major consequences. A single mistake during venipuncture can compromise laboratory accuracy, delay diagnosis, increase patient discomfort, and damage professional credibility. That is why every nurse and phlebotomist must treat blood collection as a skill that requires constant attention, precision, and discipline. One of the most common errors is improper vein selection. Sometimes healthcare workers rush to access the first visible vein without fully assessing the patient's condition, hydration status, vein elasticity, or previous complications. Choosing the wrong site often leads to collapsed veins, painful infiltrations, hematomas, or unsuccessful attempts. Strong technique begins with patience. The best professionals take time to assess both arms carefully, palpate veins correctly, and position the patient comfortably before proceeding. They understand that rushing the selection process often creates bigger delays later. Another major mistake involves improper needle angle and insertion technique. Entering too deeply, inserting at the wrong angle, or moving the needle excessively inside the vein can cause trauma, bruising, and unnecessary pain. Patients may not remember every word spoken during the procedure, but they will remember how physically painful the experience felt. Skilled nurses and phlebotomists understand that controlled, smooth movements matter. Precision creates comfort. Calm hands create confidence in the patient. There is also a critical issue many people overlook: failing to follow the proper order of draw. Some healthcare workers become so focused on obtaining blood quickly that they forget how contamination between collection tubes can alter laboratory results. Incorrect specimen collection can lead to false readings, repeated blood draws, delayed treatments, and confusion in patient care plans. Laboratory accuracy begins at the bedside. Every tube collected incorrectly has the potential to affect important clinical decisions. Specimen handling after collection is equally important. Shaking tubes aggressively instead of gently inverting them can damage blood cells and cause hemolysis. Leaving specimens unlabeled or delaying transport to the laboratory increases the risk of compromised results. These may seem like routine details during a busy shift, but details are what separate average practice from professional excellence. Great healthcare workers understand that patient safety continues even after the needle is removed. Another mistake that must be addressed is ignoring infection prevention protocols during blood collection. Failing to allow antiseptic solution to dry properly before puncture, touching the clean site again unnecessarily, or becoming careless with glove changes increases the risk of contamination and infection. Consistency in infection control is not about convenience. It is about protecting lives. Patients trust healthcare professionals to maintain safe standards every single time, not only when someone is watching. Healthcare professionals must also learn to recognize when fatigue affects performance. Long shifts, stress, and high patient volumes can reduce concentration and increase technical mistakes. But professionalism means remaining mentally present even during difficult moments. The patient in front of you deserves the same level of focus and care as the very first patient of the day. Technical skill alone is never enough. True excellence comes from combining precision with patience, confidence with caution, and efficiency with compassion. The most respected nurses and phlebotomists are not remembered simply for drawing blood successfully. They are remembered for making patients feel safe, respected, and cared for throughout the entire experience. The hands that collect blood must always be guided by discipline, focus, and compassion. Professional excellence in blood collection is not built overnight. It is developed through consistency, humility, discipline, and a deep commitment to patient-centered care. Too often, healthcare professionals believe excellence is measured only by speed or technical ability, but true excellence is revealed in how we treat people during vulnerable moments. Every blood draw is an opportunity to demonstrate professionalism, compassion, and respect. Patients may enter the room feeling anxious, exhausted, fearful, or uncertain, and the way we approach them can either increase that stress or provide reassurance and comfort. One of the greatest mistakes healthcare workers make is forgetting the human side of clinical procedures. When blood draws become repetitive tasks performed on autopilot, compassion slowly disappears. Patients begin to feel rushed, ignored, or treated like numbers instead of individuals. But the most effective nurses and phlebotomists understand that patient-centered care changes everything. They make eye contact. They listen carefully. They notice fear in a patient's voice before the procedure even begins. They understand that kindness is not separate from professionalism. Kindness is professionalism. Professional excellence also means taking accountability seriously. There will be moments when procedures do not go as planned. Even experienced healthcare professionals face difficult veins, unexpected complications, or failed attempts. What defines professionalism is not perfection. It is the willingness to respond responsibly. Excuses never improve patient care. Accountability does. Great healthcare workers acknowledge mistakes honestly, learn from them continuously, and use every challenge as an opportunity for growth. Another important part of excellence is maintaining composure under pressure. Healthcare environments can become overwhelming very quickly. Long shifts, emergencies, understaffing, and emotional exhaustion can test even the strongest professionals. But patients still deserve calm, focused care regardless of the circumstances around us. Emotional control is a skill every healthcare professional must develop. When patients see confidence, patience, and composure, they feel safer. Calmness creates trust, and trust strengthens the entire healthcare experience. Continuous learning is another characteristic that separates average performance from true excellence. Medicine evolves constantly. Techniques improve. Safety standards change. New evidence emerges. The strongest nurses and phlebotomists never assume they know everything. They remain teachable. They ask questions. They review their mistakes honestly. They seek feedback without defensiveness. Growth in healthcare never stops because patient safety depends on our willingness to improve continuously. Professionalism also extends beyond technical performance. It includes respecting patient privacy, protecting dignity, and understanding cultural sensitivity during care. Some patients may fear needles because of past trauma. Others may struggle with language barriers, anxiety disorders, or medical mistrust based on previous experiences. Patient-centered care requires emotional awareness. It requires healthcare professionals to treat every patient with patience and humanity, regardless of how busy the day becomes. The healthcare professionals who leave the greatest impact are rarely remembered only for technical skill. They are remembered for how they made people feel during difficult moments. A calm voice, gentle reassurance, respectful communication, and genuine compassion often stay with patients far longer than the procedure itself. Those small moments build trust not only in individual healthcare workers, but in the healthcare system as a whole. Every blood draw carries more than a clinical responsibility. It carries an opportunity to reflect the highest standards of care, integrity, and compassion. Excellence is not a single action performed occasionally. It is a daily decision repeated with consistency, even when nobody is watching. The true mark of a healthcare professional is not only found in skillful hands, but in the compassion carried within them.